Hello, dear student. Welcome to GDC and welcome to Pharma Thunderstorm series. So, dear student, this series is specially designed for all India Pharma competitive examination. Either it's your GPAT, NIPER, drug inspector, pharmacist, any state or center pharmacist competitive exam that is relevant to the pharma field. So this series, as I hope you all had watched the previous video also of the different subject that was designed by or discussed by the different esteemed faculty of the GDC, where we had started like quick tricks, some strong concept are there, and the powerful learning concept is there. So here I am 𝘂𝙀𝙎𝙎𝙬𝙀 with the new topic, that is antidote. Antidote chapter is just like a little chapter in your inorganic chemistry, but having a wide question in all the previous examination. Antidote, we are having the antidote of each and everything. Like in pharmacology also, we are having the antidote for the different drug, are having the different, we are having the for the heparin, we are having the protamine sulfate, activated charcoal, that is commonly, or we can say component of an we can say universal antidote. And like we are having the antidote for the anticholinergic drug, we are having the benzodiazepine fomepizole as an antidote. Like you know, for the acidic drug poisoning, we are having the sodium bicarbonate as an antidote. So different antidote we are having in the pharmacology, but here I just discuss the basic concept about the antidote, types of antidote, and what are the I will discuss a little bit about like cyanide poisoning type of things. So antidote is available in the market, as well as we also having the antidote. Like what is antidote of this study, sir? Antidote of study, like we want to do this study, we want to be perfect, we want to continue with this series. What is the antidote? Antidote means that is against, or we can say counteracting. We want to study, we want to spend my most of the hours in this study, but something are antidote for us, sir. What is antidote? Antidote means they are counteracting our study, means our mobile phone. In mobile phone, then different antidote we are having. Anti means they are against, they are working against our study, they are working against our progress, they are working against our stability. In mobile, we are mobile is a major antidote, and then further antidote we are having WhatsApp, Snapchat, Instagram, Facebook, Telegram. So these are the different antidote. Like, okay, WhatsApp is good, you will get the notification or use useful notification. Snapchat is not good, it is an entertainment purpose. Instagram, okay, it is useful if you had follow the YouTube, follow the channel of the GDC. Facebook is also important if you had subscribe, or you had add some important concept here, important channel here. Telegram is also good if you had joined the Telegram channel of GDC, where the daily MCQ has been sent, and daily notification regarding the new publications, new advertisement type of thing. So that is important, but rather than these things we are using, we are abusing the things. Rather than use the things, we are abuse the things. Like all these things in the market, either it's any edible things, any of the things like mobile phone, fast food, our laptop, our home rent, home things, like all the things are for the use, but now generation student are abusing the things. So it's an humble request to each and everyone, please use the things abuse, like alcohol in the market, chicken is in the market, some fast foods in the market. But what exactly the now youngest generation is doing? They are abusing rather than use the things. Got it? So please try to abuse, try to avoid the abuse of the things. Just use them. Coming to the topic, first with the discussion, like definition of an antidote. An antidote is a therapeutic substance that is used to counteract the toxin action of a specified xenobite. And the antidote is a compound that may be counteract with the poison. That is counteract with the poison. So what is the poison? Counteract with the poison. So poison that we are having, like we are having the poison to do better. Like I'm taking the the example in a different direction, opposite direction. Like I am having the dedication for this study, I am having the dedication to schedule my plan. But antidote, we are having mobile phone, our friend is also just counteracting, our neighbor are also counteracting, even self-controlling, self-ruling power we don't have. So if you want to do better in future, if you want to pursue something good, then self-controlling, self-ruling is necessary rather than the Kathputli. So, like rather than other can control you. Self-controlling, self-attitude, self-rule are necessary. Self-rule, it is not like that is going to take you in a good bad direction. Like we are human beings, we can analyze like which thing is good and which thing is better. But after analysis of the bad thing, like yes, I know I am doing bad by watching the reels on Instagram up to 2 a.m., 3 a.m. I know that this is wrong, but again I am just doing the repeating the things again and again. Got it? So self-ruling and self-controlling power is necessary. Next, we are having activated charcoal. Activated charcoal like heavy metal poisoning, alkaloidal poisoning, sedative and hypnotic drugs. So activated charcoal, that is the antidote for the heavy metal poisoning, alkaloidal, sedative, hypnotic drugs poisoning. We are having the different antidote. And can you please tell me like what is universal antidote? Universal antidote. Like activated charcoal is not an universal antidote. It is a major component of the universal antidote. So universal antidote is what? Universal antidote. It is made up of three components. One is our activated charcoal. Second is our tannic acid. Third is our magnesium hydroxide, MgOH whole twice. Okay. Suppose we have to prepare 100 gram of an universal antidote. Out of 100 gram, I will take 50 gram of activated charcoal, 25 gram of tannic acid and 25 gram of magnesium hydroxide I can use as an combination. So activated charcoal we had used in ratio 2 with tannic acid 1 and magnesium hydroxide in 1. Got it? So this is the universal antidote. Activated charcoal is not an universal antidote, but it is used as a major component of activated universal antidote. Got it? So in the ratio of 2:1:1 means if you have to prepare 100 gram, then out of 100 gram, 50 gram of activated charcoal, 25 gram of tannic acid and 25 gram of magnesium hydroxide. Next we are having antidote are the substance which are used to reverse, stop or counteract the action of the poison. Antidote are the substance which are used to reverse, stop or counteract the action of the poison. Alright, this is a simple definition of the antidote. Next, we are having the types of antidote. Types of antidote, we are having the next part. First, we are having the chemical antidote, means the antidote that changes the chemical nature of poison. Chemical antidote, the antidote that changes the chemical nature of the poison. Example, we are having the sodium thiosulfate, that is a chemical antidote which convert the systematically toxic cyanide to the non-toxic thiocyanate. Sodium thiosulfate is a chemical antidote which convert the systematically toxic cyanide to the non-toxic thiocyanate. Mechanical antidote. Next, we are having the mechanical antidote. Means the antidote that prevent the absorption of the poison. Means they are absorbing the things. What exactly the chemical are doing? Chemical are doing that is changing the chemical nature of the poison. They are changing the chemical nature of the poison. Means sodium thiosulfate is a chemical antidote which convert the systematically toxic cyanide to the non-toxic thiocyanide. Means from the cyanide to thiocyanate. Cyanide to thiocyanate means toxic to non-toxic. Toxic to non-toxic. Got it? Mechanical antidote, the antidote that prevent absorption of the poison. Activated charcoal is a mechanical antidote which absorb the poison prior to its absorption across the intestinal wall. Then we are having the physiological antidote, the antidote that counteract the effect of poison by producing the other effect. Here, activated charcoal is mechanically absorbing the poison. Suppose someone has had an accidental alkaloid like morphine, charas, ganza, hashish, any of the things. If someone has had eaten any like poison substance in bulk quantity, then activated charcoal is showing the mechanical and showing their mechanical action. They had absorb itself, like activated charcoal is absorbing the poison itself into the small intestine, and they unable to absorb from the microvilli of the small intestine. So they, if it is unable to absorb into the microvilli or into the blood circulation, then there is a no effect of the poison. It is as such excreted through the fecal matter. Next, we are having the physical antidote. So the antidote that counteract the effect of poison by producing the other effect. The antidote that counteract the effect of poison by producing the other effect. Example include sodium nitrate is an physiological antidote which convert hemoglobin into methhemoglobin in order to bind cyanide. Sodium nitrite is a physiological antidote which convert hemoglobin to the methhemoglobin in order to bind cyanide. Next, we are having the 𝘂𝙬𝙎𝑘𝑜𝙬𝑖𝑛E. 𝘂𝙬𝙎𝑘𝑜𝙬𝑖𝑛E is 𝘂𝙬𝙎𝑘𝑜𝙬𝑖𝑛E, that is the antidote for the food and the alkaloidal poisoning. 𝘂𝙬𝙎𝑘𝑜𝙬𝑖𝑛E, that is an antidote for the food and alkaloidal poisoning. Next, we are having the copper sulfate. Copper sulfate is an antidote for the phosphorus poisoning. Got it? 𝘂𝙬𝙎𝑘𝑜𝙬𝑖𝑛E, we are having two type of kaolin, light kaolin, heavy kaolin. So light kaolin basically used as an food and alkaloidal poisoning. Copper poisoning is used in the phosphorus poisoning. Magnesium sulfate and sodium phosphate. Magnesium sulfate and sodium phosphate is used in the heavy metal poisoning. D-penicillamine, that is copper, magnesium and lead poisoning. D-penicillamine is used in the copper poisoning, magnesium poisoning and the lead poisoning. 𝘎𝑆-ferroxime is used in the iron poisoning. D-penicillamine, that is used in the copper poisoning, magnesium poisoning, lead poisoning. 𝘎𝑆-ferroxime is used in the iron poisoning. Next, we are having the diamercaprol. Diamercaprol is used in the gold and mercury poisoning. Diamercaprol is used in the gold and mercury poisoning. Calcium sodium EDTA. Calcium sodium EDTA, that is the universal antidote in the lead poisoning. Diamercaprol, that is used in the gold poisoning or mercury poisoning. Calcium disodium EDTA, that is used in the lead poisoning, or we can say diamercaprol is succimer is used as in gold and mercury poisoning. Sodium thiosulfate or sodium nitrate, most important student, it is very important. This question was asked previously many of the time, like what is the antidote of the cyanide poisoning? And many of the time students get confused, like what exactly the antidote we are having for the cyanide and these things. So sodium thiosulfate and sodium nitrite is an antidote for the cyanide poisoning. Next, what is cyanide poisoning? Example we are having, what is cyanide poisoning? It is important, cyanide poisoning. Cyanide poisoning, what is cyanide poisoning? So in cyanide poisoning, the cyanide ion, like CN ion, okay, combined with the ferric ion of cytochrome oxidase, of what? Cytochrome oxidase, here suffix is used ase. So any word that contains suffix, or that can contain three alphabet, that is ase, means it is an enzyme, or all enzymes are protein except few riboenzyme. But this statement is okay, all enzyme are protein but all protein are not enzyme. That is good. like all enzyme are protein, okay, and all protein are not enzyme, means we are having the blood protein, albumin protein, we are having skin protein, like of the, so these are not an enzyme, but all enzyme are protein. That is the good term, but it is not completely, that is right, we can say um, line, but it is incomplete. All enzymes are protein except some riboenzymes that are non-protein in nature. That is the right term. We are having few riboenzymes that are not originate from the protein. Just search on that, comment on the comment box, and watch the video of the biochemistry and other faculty. If we will upload the videos of the enzyme also. Got it? So all protein are not enzyme. Yes, we are having variety different protein that are not enzyme. Very few proteins that are act as an enzyme. Got it? So in the examination, just read the definition, just read the statement carefully. It is not like the okay, cyanide poisoning, then okay. What exactly the examiner is asking? Just read what exactly the question, and okay, what my mind is responding for a particular question, and what exactly the option that has been given, and try to choose the most appropriate answer. Many of the time, if you had analysis of your examination, any examination, either it's your college examination, any other examination, few question are like, yes, I had choose the right option, this question, this option also be correct, but examiner want most appropriate, best on best. So you had choose best on best, that is GDC. We are preparing a good best on best content. We are started 2 series, that is best on best. So why are you waiting? If we are working on a best institution, you are watching the video of best to best faculty, so we have to choose the best on best option and prove our result. Got it? That is responsible for electron transfer reaction. So this leads to this stoppage, cyanide binds to the ferric ion of the cytochrome oxidase. That is an enzyme responsible for the ETC, that is electron transfer reaction, or we can say electron transfer chain reaction. This leads to the stoppage of the cellular respiration and metabolic reactions. So cellular respiration, the respiration that is doing with the cell, like normal exhalation, inhalation, that is breathing. Respiration means the oxygen that we have taken via the breathing has been used by the cell to perform their metabolic function, and in response of that oxygen they release the CO2, and the exhalation of the CO2, that is also the part of the respiration. Got it? So the inhalation, exhalation is our breathing, and there is a difference between breathing and respiration. In breathing we will discuss only inhalation and exhalation, but in respiration, the air, the oxygen that we had inhaled going to this blood circulation and then reverting back. Got it? So that is your cellular respiration. Cellular respiration, or we can say it is your metabolic reaction. In cyanide poisoning, sodium nitrite and sodium thiosulfate injection are given to counteract the effect of the cyanide poisoning. In cyanide poisoning, sodium nitrite and sodium thiosulfate injection are given to counteract the effect of cyanide poisoning. Got it? Next, mechanism of antidote in cyanide poisoning. What exactly the mechanism of antidote? Mechanism of antidote in cyanide poisoning. So sodium thiosulfate react with the cyanide ion and convert into the sodium thiosulfate, sodium thiocyanate, which is less toxic than the cyanide. Got it? Sodium thiocyanate that react with the cyanide ion sodium thiosulfate react with the cyanide ion, convert into the sodium thiocyanate, which is less toxic than cyanide. It is less toxic than the cyanide. So that is the exact mechanism what the antidote is doing in the cyanide poisoning. It simply react with the cyanide, or we can say after cyanide poisoning, like this process is possible here only, but if some person has taken the cyanide, then it is very difficult to revive the patient, because it takes time, like patient can take cyanide, and it is a like very rare chance that patient can revive again, because after the poison, then attendant will see, then they go to hospital, then the antidote will arrange, and like that. Okay, so this sodium thiosulfate react with the cyanide ion and convert it into the sodium thiocyanate, which is less toxic than the cyanide. Okay, toxicity is reduced. While sodium nitrate, another antidote we are having, na? Both are given in the combination. Sodium nitrate react with the ferrous ion. Sodium nitrate react with the ferrous ion of hemoglobin and convert into ferric ion of methemoglobin, thus reduce concentration of the cyanide ion. Sodium nitrate react with the ferrous ion of hemoglobin, convert into the ferric ion of hemoglobin, thus reduce the concentration of the cyanide ion. Concentration of cyanide ion reduce. Concentration of cyanide ion reduce. Ferrous ion of hemoglobin convert into the ferric ion of methemoglobin, and thus reduce the concentration of the cyanide ion. Sodium nitrite. Sodium nitrite occur as colorless, slightly yellow crystal, white opaque fused mass. It is odorless, deliquescent with wild saline taste. Got it? Sodium nitrite occur as colorless, slightly yellow crystal or white opaque fused mass. Sodium nitrite occur as colorless, slightly yellow crystal or white opaque fused mass. It is odorless, deliquescent with a mild saline taste, and the molecular formula is sodium nitrate, and having the molecular weight 68.9. What is the use of the sodium nitrite? Sodium nitrate, it is used as an antidote to cyanide poisoning and has a hypnotic effect. It is used as antidote to the cyanide poisoning. Okay, has an hypnotic effect. It has relaxant action on the smooth muscles. Sodium nitrite is also used as an antioxidant. It is widely used in meat packing, as it helps to maintain the desired red color and restrict the growth of what? That is Clostridium botulinum spore. Got it? So sodium nitrite, that is also that is used in the cyanide poisoning, as it is reacting with the ferric ion of hemoglobin and convert into the ferric hemoglobin of methanoglobulin. So concentration of the cyanide ion is reduced. And another application, act as a smooth muscle relaxant. Sodium nitrite act as an antioxidant used in the meat packaging, because they restrict the growth of the Clostridium botulinum spore. Got it? So this topic that we had done is basically the antidote. I hope you all had enjoyed this chapter. Try to find the different antidote of your pharmacology. Try to make the cross questioning with your colleagues, like what exactly the question they are having. Cross questioning will get, after the cross questioning, your mind gets sharpened and you will get more and more. So thank you so much everyone. Have a good day. Be happy. Keep learning. All the best for examination.